Okay, this is Ron French again from the Shoulder and Hand Therapy Center in Paris, Tennessee. We've talked about what carpal tunnel syndrome is. We've talked about what the surgery is and the initial exercises that you should be doing. So at this point we're about day 10 and you're going to go in, the doc's going to take your stitches out, he's going to put those steri strips on that we talked about, and you're going to increase your exercises a little bit. Now when your wound closes, you're going to need to start to massage it. Remember that scarring doesn't stretch. And so when I bend my hand back like this, the skin has to stretch around any bends, and that scarring is going to try to hold you. And it's not going to want you to be able to come back. You'll feel that, like if you're a lady, you're going to feel that trying to make a bed. Put your hand on the bed. If you're trying to do push-ups, many things. You really need all the extension that's normal for you. And so you want to start massaging that scar, and you want to massage it fairly deep because you're trying to break it loose. You're trying to break it up, and so there's just minimal scarring in there. The other thing that's going to happen is this transverse carpal ligament that we talked about in the first video that he cuts through, and that we talked about in the second video. When it starts to heal, it's going to start to draw tight. And that can be a problem because it can cause some pain. Now, underneath all of this are those carpal bones you've heard about. And there's 8 of them. They look like little rocks. And there's a couple of them that have what we call hooks, where they kind of stick up, and they stick up this way. And if you have a real small hand, you can kind of find it just to the baby finger side of the middle part of your palm. If you dig around in there, you can find that little hard lump. And that's the hook of the hamate. And so it's sticking up. So imagine as this transverse carpal ligament starts to draw and get tight, and it starts to poke as that gets tight. And you feel a little soreness right in there. It almost feel at what they used to call sore as a rising. It gets really sore. You touch it and it's just, oh, I don't want to touch that. That's because that transverse carpal ligament is tightened over the top of that, and it's poking from underneath. And in the therapy world, we call it pillar pain. And so again, massaging this whole transverse carpal ligament, loosening it up, will help a lot with that pain. I also recommend that you use some vitamin E oil on your scar after you massaged it dry first. So you do your little massage, break everything up, get as loose as you can, and then put a little bitty drop. You just really need just like 1 drop on the scar itself. Make sure your scar is not open. You don't want to put oil inside an open wound. We want it all the way closed, and you're going to rub that scarring in there, and that's going to help soften the scar, help break it up, help flatten it, and the overall appearance will be better in the long run. And so now we want to talk a little bit about your exercises, because the exercises change now. You can be a little more aggressive with it to get that extension in your wrist and that flexion back in your wrist. The best exercise I like to tell people to do is to put your hand on the edge of the table. Can you see my hand there? And you're gonna hold your hand down, raise your elbow up high as you can handle it, count to 3 Mississippi, come down. Then I want you to go under the table with the elbow. Count to 3 Mississippi, come back up. So it's up and down. You always take it to the point where you feel it hurt just a little, but you can handle that pain. It's not anything serious. You can handle that for a while. Don't take it into high pain. High pain is your body telling you, hey, I don't like this, something's wrong, don't do it. And so listen to it. This isn't the high school gymnasium where no pain, no gain is chanted everywhere. We don't want a lot of pain with this. That's going to go ahead and give you your full flexion and extension of your wrist, those 2 exercises. Sometimes we'll have a little bit of tightness coming back and forth sideways like this. We call that deviation, radial deviation, ulnar deviation. You can put your hand on the table just like before and shift your elbow all the way to the right, all the way to the left, all the way to the right, all the way to the left. And that will help with that. You're going to find that you've lost a little strength. It's absolutely normal. It's okay to get yourself a nice little squeezy ball and work it. And what I don't want you to forget is not only working on your grasp, but work on your pinch. If you'll watch yourself during the day or watch someone else, you'll find that most of the things you pick up with a pinch, not a grasp. And so work on the pinch as well until you're satisfied with the strength. You'll know. And also, the more you use your hand, the stronger it's going to get. The reason it was as strong as it was before the surgery is probably not because it had exercisers. It was all the activities it did all day long. And so the quicker you can get back into those, the quicker your strength will come back. There's also other types of strengtheners. This is what I like to use at my clinic, and it's just a band resistance strengthener. You can probably find these on the internet somewhere. Or if you want to contact me at shoulderandhandtherapycenter.com, we can mail you one for a nominal fee. But what I want you to remember is that carpal tunnel syndrome, carpal tunnel surgery, carpal tunnel recovery we got it down pretty pat. And they say that about 10 to 15% aren't, that the surgeries don't turn out well. A lot of times that has to do with the patient waiting too long, and that median nerve in there has been pinched so long that it's damaged and it's never going to recuperate. So this is something you don't want to wait a long time about, because when a nerve dies off, it's in bad shape and you're going to have pain for a long time. That's it as far as the carpal tunnel goes. I'm Ron French from the Shoulder and Hand Therapy Center in Paris, Tennessee. Have a great day. Thanks.